Our next topic is pilonidal cyst. So you need to know what is a pilonidal cyst. What is a cyst in the first place? A cyst is a growth with a circumscribed wall, which is a sealed wall, right? Like grapes. You can imagine a grape. So you have the fluid within a grape. Same way, a fluid within a cavity is called as a cyst. So we say it's a pilonidal cyst. Again, break down that word, which is pilus plus nidus. Meaning pilus meaning hair, nidus meaning a nest. So this cyst forms in a place exactly like the sacrococcygeal region, or in the gluteal region, the gluteal cleft, and this might sometimes contains even hair in it. So in order to remove this, a physician can either, if this cyst goes to the next level of the result of inflammation is suppuration. So if suppuration has taken place in the cyst, it becomes a pilonidal abscess. So in that case, the physician, if he is going to remove the abscess, like he's going to do an incision and drainage of the pilonidal abscess, you can go with 180. If that is going to be a complicated abscess, with subcutaneous extensions, or the physician has to dissect more, in that case you can code it as a complicated abscess removal. Okay. So here, while dealing with pilonidal cystectomy, we need to know another thing, which is there is something called pilonidal cystectomy in addition to the drainage of pilonidal cyst. In a pilonidal cystectomy, it is again classified into three codes. So one is as a simple excision, second as an extensive excision, and thirdly, which is a complicated excision. In a simple excision, so the code would be 11770, the physician uses a scalpel and he excises it, and then he removes or whatever the extract or the products of suppuration is there, he removes it and then he closes it. That is a simple closure or a simple removal of a pilonidal cyst. Here, a single layer closure of the cyst is being done. Next is extensive. When we mean an extensive, there is an extensive sinus with subcutaneous extensions. So if that is the case, and if the physician is employing more than a single layered closure, say it as a 2-layered or a 3-layered, it goes for a extensive pilonidal cystectomy. And finally, you have this complicated where the physician employs local grafting like Z-plasty or a Y-plasty. This becomes a complicated pilonidal cystectomy. So now this is how the classification goes based on the diseases and type of technique. Is it mere drainage or is it the complete removal of the cyst itself?